Are you suffering with sciatica and confused about what you should or should not be doing? Have you searched on Dr. Google, who gives you contradictory advice and you're not sure where to go from here? Today we're talking about the top do's and don'ts if you are suffering with sciatica pain. So first, real briefly, what is sciatica pain? Sciatica pain is pain in the sciatic nerve, which starts in the low back and goes down the back of each leg. At the knee, it splits and it kind of goes down the side and the back, so it kind of goes through the calf as well as the side of the leg. So if you have a shooting pain that is starting in your back or even starting in your butt and going down the back of your leg, you probably have sciatica. But the question is, what should you do about it? So, what's the most important thing to do with sciatica pain? Strengthen your glutes and your abdominals. You want to make sure you have support of your low back to take pressure off that sciatic nerve. Now, it's really important, obviously, to have the abdominal strength in the front because that helps to support the low back, but you want to make sure that you're really activating those glutes. A lot of people who are having sciatica pain feel like, oh, if I activate that glute, it's going to make things worse. But if you activate that glute, it gives more support through your hips and decreases tension on the sciatic nerve. It's really important to make sure that those glutes are firing. They tend to turn off when you have sciatica pain, which puts more pressure on your low back, which actually makes your symptoms worse. Now, what I do not want you to do is to be stretching the leg that has the sciatica pain. This is a common mistake, and there's lots of information on the interweb that says, oh, if you have sciatica pain, all you need to do is stretch it. Most of the time, especially when that nerve is super irritated, stretching it is actually going to make it worse. It will make it feel better for the short term, but it will make it more aggravated in the long term. If you feel like, I really need to stretch though, because I really need this pain to go away, stretch the other side, because doing that will help to take some tension off the sciatic nerve. So if you have pain down the back of your right leg, go ahead and stretch your left leg or your left hip, and you will get some pain relief. If you stretch the right leg, the one that's painful, it will give you some short-term relief, but it's going to be like a boomerang that's going to come back and slap you upside the head later on. The next thing that you can do for your sciatica pain is to use ice. And where do you use ice? Wherever you feel the pain. So if your pain starts in your low back and it travels down through your butt and goes down the back of your leg, then ice your back for 5 minutes, your butt for 5 minutes, the back of your leg for 5 minutes. If it goes down into your calf, you can follow it all the way down. Definitely start at the low back or the butt, wherever you feel that initial pain point, because that's actually the root of the issue. So that's the most important thing to ice, but you can also ice further down where you feel pain, because that's going to cause pain inhibition or a decrease in that pain signal. And yes, I admit it's a Band-Aid and it's not going to fix anything in the long term, but hey, if you could get a couple minutes of relief, wouldn't it be worth it? And when you ice, you only need to ice for 5 minutes in each location. The research clearly indicates that the maximum amount of pain inhibition comes in the first 3 to 5 minutes, so you don't need to ice for longer than that. Now, if you found a really good spot and it feels really good and you want to ice for 20 minutes and you're really comfortable, absolutely not a problem. I have no problem with that. You can ice for 20 minutes. It's not going to cause any damage or anything like that. But if you're on a tight schedule and you need to get a couple different locations in and maybe you only have 10 minutes, just do 5 minutes at each location and you'll still get really good benefits. What I don't want you to be doing is using heat. A lot of people feel like the heat will help to decrease the muscle tension, which will help to increase the pain in the sciatic nerve. What actually happens is that the heat increases the blood flow to the area, which causes increased swelling around the nerve, which puts more pressure on the nerve, which actually helps to increase your symptoms instead of decrease your symptoms. So for right now, while it's really flared up and super hot and really pingy and going all the way down your leg and you're just about to rip your skin off, no heat, only ice. All right? Don't heat and ice. No, only ice, no heat. Okay. Another thing you should do if you have sciatica pain is drink lots of water. And if you drink lots of water regularly, I still want you to drink a lot more water. The sciatic nerve is irritated because there's a bunch of inflammatory stuff around it, and it's getting really irritated from sitting in that inflammatory soup, which is definitely not what we want. The best way we can move that out is to do some gentle motion and stay hydrated. That will help to flush the body and decrease those pain signals. What I do not want you to do is go get a massage. I know many people are going to find this very controversial, but here's the thing. I know that your muscles are tense. I know that they're really irritated. They're really irritated because the sciatic nerve is really irritated and it's pinging off and it's causing all those muscles to tighten. But the muscles are dumb. They can only contract and relax. So they're responding to the pain by contracting. And I know it doesn't feel good, and I know you just want to get a massage to relax the tension in those muscles, but what will happen is you get a massage, you decrease the tension in the muscles, and then the whole kit and caboodle just kind of falls apart. And it's actually going to increase your pain afterwards. So it will feel good while you're doing it. It might even feel good when you get off the table, but it's not going to last very long. So don't get a massage right now. Put that off. Once you're recovering and you're not having that pain signal that's going all the way down your leg and you just end up with the muscle tension that happens after sciatica, then you can go ahead and get a massage. Trust me, it's not going to help. It might actually damage you in the long run, and you don't want to waste your time and money. The next tip, if you're suffering with sciatica pain, is you do want to keep moving through the day. Many of my clients who come in here, as soon as they start having sciatica type symptoms, boom, they're in bed and they're staying there until the symptoms go away. The problem is that the symptoms won't go away if you stay in bed. We've got to keep moving. Movement is life. Every tissue in your body, including the sciatic nerve, is able to heal itself as long as things are moving correctly. So you need to keep moving regularly throughout the day. If you need to sit down for work or whatever, to eat, whatever, that's fine. You don't have to literally keep moving every moment of the day. But I don't want you sitting or lying down for long periods of time other than to sleep at night. Obviously, don't get up in the middle of the night and go walking around. That's not, no, you need your sleep. Sleeping is when you're healing. Get your good night's sleep. However, whenever you're awake, I want you to get up regularly throughout the day and make sure that you're getting some movement. I usually recommend 5 to 10 minutes every hour just so you keep the blood pumping, keep the healing happening, go drink some water, all that good stuff to get that healing process really accelerated. Now, the thing I don't want you to do is to try to walk it off. I have also had patients who have come in and said, hey, it was bothering me, so I just went for a walk until they couldn't walk anymore is basically what happened, and they had to call somebody to come pick them up, because you cannot walk this off. Although you do need to keep moving, that is a good thing. Trying to think, oh, as long as I just walk and walk and walk, it's going to go away. No. There is such a thing as too much movement, guys, and apparently if your sciatic nerve's bothering you, things are not moving correctly. So we do want to keep things moving so we get that inflammation moved out, we get those healing cells coming in, but we do not want to be moving so much that it actually causes more inflammation. I know it's a difficult balance. That's why I say 5 to 10 minutes every hour. If you're suffering with sciatica, you don't want to wait to get expert help. This is not a situation that usually goes away on its own, and even if the symptoms go away on their own, the root cause does not. So it's really important to find somebody who can help you not only diagnose the sciatica, you probably already know you have sciatica, but to understand the root cause. What happened that causes sciatica to start up now? That's what you need help in finding. Now, it's very important who you choose to help you with that. You want to be working with a specialist who has information on sciatica and the different structures that can be involved, because it is really important to understand which structure it is. Remember that movement is life. The body is able to heal itself completely as long as it's able to move correctly. But you need to know what structure you're dealing with, or else you don't know how to treat it. So a diagnosis of sciatica, yes, that's pretty simple to come up with. It's more finding the root, having a specialist help you find the root, because then you get that real healing that will keep this problem from coming back. What I don't want you to do is to wait more than 7 to 14 days to get help. A lot of people want to wait and see how things go initially in the beginning, and I understand that. But if you are still suffering after 7 to 14 days, your body is sending up signals and saying, I cannot heal this on my own. So make sure you call and get a specialist to see you within 7 to 14 days so that you can start on your healing journey. What I find most often is that people wait too long to get help. They get to the point where they just can't stand it anymore and they are willing to have surgery because they just need this pain to go away right now. Or they have dealt with this issue for so many sessions or episodes, they've been dealing with this for a long time, that they're ready to do surgery because they've never addressed the root cause. They may have done chiropractic before, they may have done physical therapy before, but nobody has actually addressed the root cause of what's going on. They've just tried to treat the sciatica. Now the problem is, if you just treat the sciatica, yes, the sciatic nerve is inflamed. I understand that, but we need to know why. Why is that sciatic nerve getting inflamed? If it's happened again, why is it getting inflamed again? If we get this tunnel vision and we just focus on the sciatic nerve, we're not going to deal with the root cause. It could be the knee, it could be the hip, it could actually even be the upper back. There's so many things that could be causing there to be an abnormal stress through the sciatic nerve. That's why you need a specialist to help you figure out what it is that's your root cause that's actually caused this symptoms in the first place or caused them to return. If you have any questions, drop a comment below. We would love to answer them and create a video just for you. Have a great day, everyone.